Hi, Dr.
Yes,
Jaison.
yes.
Welcome to Body Perfect Doctor Show.
Thank you very much. Yes, please.
You know, today is Global Fatty Liver Day.
Yes, today is the most important day for us, like people we are into the health and wellness industry. Today is the Global Fatty Liver Day, and many people out there, health professionals, actually close their eyes for today. They don't do much. I'm sorry to say that, but we have to do something as all people who are in the fitness, wellness, weight loss, trainers, doctors, Ayurveda doctors, physiotherapists, anybody out there. If someone with a little fatty liver, we have to be careful now because this can cause many things. I want you to stay tuned till the end of this video because this is an amazing workshop, at least an eye-opener for you guys. If you stay till the next 30 minutes, you're going to have an amazing information which many doctors may not able to give you.
Correct.
So today's world or Global Fatty Liver Day, we're going to explore the next 30 minutes with a lot of information which actually can maybe save thousands of people in this planet.
Okay, I have a few questions for you.
Yes, please.
So, can you explain the difference between alcoholic fatty liver disease and non?
Before that, you have more other questions to start with. The first question.
Well, what is the importance of the?
Okay, stop. Now cut it off.
Dr. Jaison, what is the importance of this live?
So once again, we said it's a global fatty liver day. Many people are ignorant actually when they do a basic test. An example, doctors, like today I had an event. This is what I wanted to tell you. Actually, I was with a client like exactly half an hour before, and one of my senior doctor, actually I have Ayurveda doctor, physio doctor, I have a GP, I have an orthopedic surgeon. Because we are a DHA clinic, we have a system actually, we have a polyclinics. So I have from an alternate medicine doctor to a GP to an orthopedic surgeon to a stem cell specialist. That's what in Body Perfect. So
Great.
yeah, one of the senior doctor, and I was just doing a consultation. This particular lady came to me and said, this is my report. I have a grade 2 fatty liver. And I said, I was just doing the consultation. I said, ask her to check the report and tell me what is that. And she came and she checked the report and she straight away started to tell me, Dr. Jaison is not worried. She just only have a grade 2 fatty liver, and she's actually senior, but she never come into any consultation. She's actually hold on rehabilitation side. So I just told the doctor, please understand this. Now we are telling the client that's a grade 2 fatty liver is not to worry. It's going to the next stage. There are changes. There is something in the report itself saying it's a stage 2 fatty liver and there are changes is happening and in a clinical observation needed, and we need to change their lifestyle modification. And even the report says this, and last 6 months, she done the report in December. 6 months she haven't done anything. She put on 5 kg. I believe she has in between almost anything between grade 2 to fibrosis. Now there is no more stage, one more stage only. So that is actually, she's almost killing herself.
Yes.
And the doctor is guiding her, is it okay to have it? So today, this seminar is very important. This workshop is very important. People are there with the fatty liver. Most of us have a fatty liver. I had fatty liver. I'm sure Joy had a fatty liver. Everyone will have a fatty liver. Fatty liver can kill someone, and that can accelerate heart disease to other disease. Because I say liver is your left hand because 500 of functions it does, and the heart is your right hand. So today's seminar is one of the most important seminar. If you stay tuned, if you have a little fatty liver, you cannot lose weight. I can reverse that fatty liver. You can lose weight, get fit, improve your health, and maybe stay away from heart disease, and you can save someone's life.
Okay, can you explain the difference between alcoholic liver disease and non-alcoholic liver disease?
It's a good question. I think they call us an non-alcoholic fatty liver is non-NAFLD. So what does that mean? Then people drink alcohol and people don't drink alcohol. Am I right? There are certain variations. Actually, there are liver conditions from hepatitis and other conditions. We are only talking about from the lifestyle. We're not talking about the other kind of fatty liver. because for us is very important is 95% or 98% of the population, and this fatty liver actually comes from the lifestyle. So we are only discussing about those particular points. We are not into a medical doctor system to teach everyone. Here we are planning, and we wanted to get the benefit of what is a fatty liver and how we can reverse the fatty liver lifestyle. Now the question was Joy asked is basically the fatty liver is literally if it's a fatty liver from the alcohol or non-alcoholic fatty liver. Let's say Joy is 95 kg. Today he start eating some starch or sugar or fructose. I will explain to you more later on that later on this video is very important. Even if you drink a glass of orange juice, or maybe instead of eating a whole fruit, if you drink a lot of orange juice with some sugar, or maybe if you're drinking like 2 lime soda or some juice with the sugar, it can actually make you a fatty liver. You don't have to drink alcohol. So people who eat a lot of fried food, fatty food, junk food, starchy food, refined starch, and even if they eating or drinking a lot of fructose, fruits. People think that fruits are healthy. I'm telling you, someone is overweight if they're drinking fruit juices. That's actually worse than drinking alcohol. This is an eye opener for you, many of you, because I have many clients comes to me and say, hey, I am in a healthy diet and I was not overweight. Now I put on weight. I don't know, because I put on weight and doctor saying I have a fatty liver. I don't drink alcohol, and I find out many of them either change their diet to a lot of eating a lot of vegetable is okay. They drink a lot of, instead of eating whole food or whole fruit, they drink a lot of, instead of water, they drink 2 to 3 glasses or 4 liters, 1 liter, 2 liters of juice, someone I found. And even the refined drinks, like the colas and sodas and refined starch, all this can actually elevate or the risk of chances of having non-alcoholic fatty liver. Now everyone knows that people who drink alcohol, it affects the liver. And the beautiful thing is actually, or the most important thing is, people think that when they drink alcohol only, it affects the liver. But interestingly, the studies found that when you drink alcohol and when you don't drink alcohol, when you get a fatty liver, it's the scars on the liver is the same, the grade is on the same. So you don't have to drink alcohol to get a fatty liver. So one is from the food, when the junk food, including this. One more important point is, some people are getting fatty liver actually from, liver is the gatekeeper. I will explain that later. 500 function, you are passing out the busy street, lot of pollution, you are breathing. The liver is the one, the mechanism of the liver is to clean it up. Right. You're drinking the water, it's cleaning it up. If somebody is smoking, secondhand smoking, you cleaning it up. You eating a vegetable, an example. Yeah, you are getting like if you have a cabbage, they pesticides, herbicides, all these things actually, like goes into this vegetable. You just literally wash and it's still the chemical. You eat it. You think that I'm a vegetarian and you're eating all that veggies, and it's all actually liver's jobs to clean it. And this is also can cause fatty liver. It's not just that, you're thinking you're just eating like more starch or sugar or fructose. Everything is the job done by the liver. That's why many people these days getting fatty liver and inactivity. So you don't have to drink alcohol. When you drink alcohol, you get liver become fat. The same way, if you eat this particular, your lifestyle can cause you also fatty liver, and both the condition is same, the grade will be the same, and the scars will be the same. End of the day, both the stages will reach to a liver cirrhosis, and that's the stage we cannot do anything, reverse the fatty liver. But grade 1, grade 2, fibrosis, and till the fibrosis liver is the beautiful thing. I will tell you a story. I met a doctor, and we used to have a gym called Jaison's Fitness was in Kerala, and the 10-15 gyms we had in that. I used to have hundreds of doctors used to come to my Oberoi gym, Amrita doctors, in Astor Medicity doctors, and all they're my friends. So one of the doctor, I don't want to mention the name, he's a famous liver surgeon, and he done to one of the famous celebrity, and he died, and the other one is still alive and he's recovered. And he was telling me I had to get a donor, and that donor give actually minimum of the biggest chunk of 70% of the liver or 80% of the, you need to cut it out. So major part you have to cut it. So an example, if someone want to like if you wanted to be a donor of mine, you should have a healthy liver. Then only, so 70% of the liver you have to cut it from you and to put it on me, then only it can be a liver transplantation. Basically when you do that, when you transplant the liver, you only have 20-30% of liver left, and that will regrow within few months as normal. Imagine, you only have 30% left, and the 70% will regrow in your body, and it has to get in my body and has to reverse and regrow it fully.
Yes.
You understand? So imagine, so you have a grade 1, grade 2, grade 3 fatty liver can reverse that fatty liver and save your life. So but only the thing, stay tuned, I'll tell you how we can reverse that. If you have a fatty liver, you should listen. If you're overweight, you should listen. If you have a PCOD, you should listen. If you have a thyroid condition, you should listen. If you have any lifestyle diseases, if you have even cholesterol, BP, you should listen completely this seminar, this live, I would recommend.
Indeed. Dr. Jaison, how is fatty liver disease diagnosed, and what tests are typically used for diagnosis?
Yeah, so normally typical tests are another important point, Joy. This is very important. Many people or doctors actually don't understand this thing, and it's a really ignorant. I'm telling you, I consult at least 25 to 50 people a day with obesity. An average person will have an abdominal obesity of 10 to 20 kg to 100 kg. I have people comes to me, and they all tell me that I don't have a fatty liver. And why? Because the doctors, I've done a test actually last month, and the doctors told me that I don't have a fatty liver. But when I look at their report, they have around 15 kg of visceral fat, which means 80% of the fat they have is accumulated in their belly, and that already may be clogging the arteries. They are already having the liver fat, because when you have visceral fat is on your internal organ. What is in internal organs? Your pancreas, your liver, your heart. All these organs actually will have the fat, and you don't have enough space to space it out. Then it becomes clogged, and end of the day that leftover fat will go into the arteries, and it can trigger your heart disease. Now, people comes to do normally the test is actually suggested. They say, okay, go for a blood test. And in the blood test, normally you cannot find out properly whether the person have a fatty liver or not fatty liver. On the particular day, might say you don't have a fatty liver, but literally what you need to do, the question was for you, if you have a fatty liver, if you have a little extra belly fat, I would insist you, if you have a belly fat, then you have to go and do a fibro scan. What do you do?
Fibro scan.
It can call as a CT scan or a fibro scan. When you get a fibro scan done, you have a proper result and a report. It would say you have a lesion, you have a grade 1, you have a grade 2, you have a grade 3, you have a grade 4, which is the liver cirrhosis, and we can treat it. It's not that because you have a grade 2 fatty liver, you don't have to worry from the blood test. Even if you have a grade 2 or grade 3, maybe the report won't say. So I would insist you to do test. People watching today this video, I want you to do, if your doctor even didn't insist you, in case you have a pricking pain here on the right side of the belly, it is actually a sign of, it's like a needle pain, like it prick and go, it may have a chance to have a fatty liver. Or if you are, somebody is smoking it from the far, and actually you can feel the smell on the petrol station. Actually, probably you may be asking a question. There's an advance, I'm going to give you the answer. And you have to go for a fibro scan. And very important test, one more test for HDL, LDL, VLDL. If anybody want to know that, that's in my other video. Or you can personally ask my question. If you want to save your heart, that's the two tests I always say. One is a total lipid profile test with HDL, LDL, and VLDL. And the second one is the fibro scan. Thank you.
Okay, are there any lifestyle factors that can contribute to the development of progression of fatty liver disease?
Yes, definitely. Everything which I have earlier mentioned is all the lifestyle, including the pollution to the water to everything. And apart from that, which I mentioned, people's lifestyle, people think that sometimes we eat, maybe we think that the food that we eat is actually don't digest and assimilate. So an example I'll tell you, somebody eat a whole grain, somebody eat a parota, and the wheat, gluten, body may not be digested. It actually can cause you different condition and acidic reaction in your body. So the food that you have to be compatible or you have to be eat and digested, that's the most important thing first place. That is, maybe people think that I'm eating a healthy food, maybe it's not a healthy food. And if they eat fatty food and starch, and they don't have to eat actually fat. Fat won't make you fat. It's actually starch make you fat. Sugar make you fat. You understand? Fructose make you fat. There's three things many people don't understand. So if you look at it, sucrose, which is S, sugar, S, and this 2S is very important, and starch, refined starch, so 3S, so SSA, then you have F, which is SSF, that is fructose. This four things is the major culprit of fatty liver, then I would say than alcohol and fat, which people think that alcohol and fat makes you fatty liver. If you eat 3 egg yolk every day, and if you eat a piece of meat with the fat, nothing is going to happen. It is these four things. That's SSF, SSF, that's the most important thing than the other thing I would say.
Okay, what are the potential complications of untreated fatty liver disease?
This is a very simple thing, exactly like the lady. This is a very interesting point that Mr. Joyce said. Actually, the lady which I met earlier, an example I tell you, and many other people, I can give you 1 or 2 examples. This lady actually diagnosed in last year, beginning of the last year, she had only grade 1 fatty liver. End of the year, she got a grade 2 fatty liver. Now she came after 6 months and her visceral fat is high, and I'm thinking she has a fibrosis. I'm thinking most likely she has. Now, it's exactly like this when Joyce said, sorry to say this point, actually, this is a comparison you can understand. When a girl become or a woman become pregnant, it's not, she's not getting 1 month and stuck with it. The next month it will be grade 2 months and 3 months and 4 months and 9 months, or after the completion of 32, 34, 36 weeks, she gave birth. The same thing here. First level, if you don't get treated, it will go to the next level. If you put on weight more, it's going to be fibrosis, and there is no 10 months like this, like a pregnancy.
Yeah.
Here you only have 4 months, an example, or 4 stages, an example, and the 4th stages will be liver cirrhosis, and it will be and difficult part is, if you have a kidney transplantation and you have a higher chances to success. Sure. And here in the liver you have and it costs you millions. Yeah.
Yes.
All right.
How does weight loss and exercise impact fatty liver disease management?
Okay, this is a very good point. Actually, people don't understand. If you are overweight, you have a high chance to have a fatty liver. Many people complain and say, "Oh, I don't have a fatty liver." When we see it, excess weight is one of the main cause of fatty liver. So if you're overweight, height weight chart, if you have muscles, yeah, you can carry another 5-10 kg. If you don't have muscles and if you have a belly fat, definitely you have a fatty liver, and that can cause you even a heart disease. So act today itself.
So is fatty liver disease reversible, and what are the chances of recovery with proper treatment?
Okay, there are people like my stages. I would say to very interesting point. This one, I had a person actually with cirrhosis, and doctors actually left him over, and I had a good case of within 1 year I reversed his fatty liver completely. But that is a big process actually, a lot of fasting and real some supplementation, not the medicines, and I managed to reverse it. But forget about the liver cirrhosis. If it's a grade 1, grade 2, grade 3, even if it's a fibrosis, we can get a good result within 6 months time, and that real lifestyle modification can help, and we can reverse within 3 to 6 months if you have a good diet and exercise, which is, I'm saying, the right kind of food, not the diet. You understand? I will explain to you, or one of the other videos we will come up with it, and they can reverse it actually. Yeah.
Good. So are there any preventive measures that individuals can take to reduce their risk of developing fatty liver disease?
This is another very good question. As I said before, if someone is exercising a regular basis, see, the most important thing is if you're consuming extra calories, what will happen? The bank deposit will accumulate.
Yeah.
When your bank deposit accumulate, you get the interest. Am I right?
Yes.
And that is interest is actually you have fatty liver. An
Okay.
example. You understand? So your job is to what? You don't deposit too much of money. So you need to have to, like an example, if you have a car, if you need to go to Abu Dhabi, or if you need to go to from India to one city or other city, you need 5 liters of what do you call the fuel. If you fuel at 10 liters, the 5 liters of fuel will be left over.
Yes.
Same thing with your body. If you need around 2000 calories, if you are eating 3000 calories, body will be depositing 1000 in the bank. And to reduce it, you need to do 2 to 3 exercise, 3 hours of exercise, which is very difficult for people to do it. And that is the case. Actually, people are putting on weight, and that is the stages you get, diseases. You understand?
Yes.
It's not that fatty liver, any kind of lifestyle diseases.
Okay.
Yeah.
Okay, Dr. Jaison. So, is there any medicine for this fatty liver?
It's another very good question. My answer is very simple: diet and exercise. When I say diet and exercise, it's not reducing the food, eating the right food, reducing the starch amount. I showed you the 3 S's and the F, that starch, sugar. That refined starch is one of the major culprit, and sucrose and fructose is one other culprit. This is a research is saying, not me. If you're drinking a lot of fruit juices, fruits has to be cut out. You can eat low glycemic fruits like I will give you all these things list. If you wanted to personally message me, and you can walk into one of my places in Body Perfect Holistic Center, Marina, Karama, Berjuman, and Sports Bay Karama, and Power Gym, and all these places our doctors are available. You can get all these things, details, but most important thing is here, you need to reduce the starch and sugar and fructose. You can still eat fat won't make it, and definitely no alcohol, or maybe moderation if you are drinking, which are all that things. If you're drinking, you should not eat protein. I can't suggest you alcohol, but even if you drink a peg of alcohol, you may go and get a fatty liver. But if you drink 2 glasses of orange juice or fructose, or even if they're refined like Pepsi or Coca-Cola, you may get a chance to get it. You understand?
All right. So, what is the relationship between fatty liver disease and obesity?
Fantastic question. Actually, all the people, when they accumulate fat, I told you, when you have obesity, means you have an excess fat loaded in your internal organs.
Yes.
And when you have a loaded in internal organs, that is definitely a fatty liver. You understand? That is accumulating on your liver, in your heart, and your pancreas, and that is actually causes fatty liver and other diseases. So as soon as you lose weight, some of the fat actually reduces from your internal organs also, according to your genetic.
So, can you tell me how weight loss impacts fatty liver disease progression and management?
Okay, very important question, and the good answer should be it's genetically only. There's a lot of it's not that if you just walk every day 30 minutes, if you are 120 kilo, it's not going to do many changes. The changes will happen when you put the right fuel. Exercise, many people think that I can just go to the gym and I can eat and drink anything, which is not the policy. You need to have a real regime. The regime is actually comes from your food. You are what you eat. Mr. Joy, you understand?
Yeah.
And this is people don't understand, and you have to do a lot of fasting. The proper criteria of this program, if you wanted to get, I can give it to you. This is a full-fledged program. We are available with the Dr. Jaison's programs on reversing fatty liver and some supplementation. But the most important thing is once the person lose weight, he can reverse fatty liver, but it's not necessary to be from the liver. So that's a specific program you need to adopt, and the specific diet you need to adopt, and you can do a liver detox plan with I will give you an example. Even if you drink beetroot, carrot, ginger, parsley, lemon, celery as a juicer, Dr. Jaison's liver detox plan, you just drink in the mornings. In 7 days, your liver started to say thank you, and within 2-3 months, you may able to reverse it. So real lifestyle with a real diet can give a lot of impact on fatty liver.
That's great. So, how much weight loss is typically recommended for improving liver
So
health?
it's an example. Somebody with 100 kg, that ideal height weight would be maybe like 10 to 15 or 20 kg to lose it. So whatever the excess weight that person has to lose it, then only you can reverse fatty liver. Even that stage also, some people may not lose from the liver. That's why you need a right kind of diet. Maybe you lose from other areas, you may not lose from it. So that is specific diet, specific supplementation, specific juicing you need, vegetable juicing you need.
That's a good one. So, are there any particular types of exercise that are especially benefit
All right.
for reducing
So
weight?
I have always suggest people that to shock your brain. To shock your brain, you need 2-3 things. What is to shock your brain? You need fasting. fasting is to shock your brain. When your brain is shocked, every now and then your liver will breathe and your heart will breathe. And I always tell people liver is a gatekeeper. What is it?
It's a gatekeeper.
Gatekeeper. An example, this is the most important thing and take away from here. I always stress people, when your liver is clean. Now, I was telling you 1 minute, in a minute, like for me around 1.5 to 2 liters of blood coming to my liver to clean. So, if I have a grade 1 or grade 2 fatty liver, half of the blood is going without screening. You understand? And liver is the one to clean that blood. Am I right? So liver is a doorkeeper, is giving opening. When you have a grade 1 or grade 2 fatty liver, then what is happening in an hour is 1 to 2 liters means 120 liters. You understand? In an hour. And you multiply by 24, it is 2 to 4,000 liters of blood coming to liver to clean rotationally. So half of the blood is going with the toxins, means it accelerates the medical conditions, lifestyle diseases. Am I right or not?
Right.
Now, when you have a fatty liver, the lifestyle is important, and he was asking the shocking the brain is what? Fasting is what? Intermittent fasting is good, but there are ways to do it, not the people what they are putting in the market. It's not the one which is, I have a specific way to do it. You can drink wheatgrass juice powder, cayenne pepper, water, lemon water, a lot of things, beetroot juice. Then throughout the day you can drink and you fast. Number 2, you have to do HIT. What is HIT?
HID, high intensity interval
Training, high intensity interval training, which is you need to elevate your resting heart rate. If an average person has a resting heart rate of 72, 207 minus your age, so Mr. Joy is 40 and it's 207 minus your age is 160, multiple by, now normally for a weight loss we suggest 60 to 80%. Here the heart rate can be anything above 90%, and the heart rate has to be maintained anything in between 125 to 145, and that activity should be when your glycogen is depleted. So an example, Joy will go to the gym, walk or cycle or cross train. I would preferably not to walk, and walking is not an exercise. I would suggest, even if you are a gym owner, including me, I should throw the treadmill, or it's not walk. You should go into an interval cycling or a spinning bike or a cross trainer, elliptical, and you just increase the heart rate to 130, 140, 5 minutes, and go to the gym, lift weights for 30 to 45 minutes, come back and do a cardio exercise or interval training, or maybe a 10 minutes of sprint or that kind of exercise which can elevate the heart rate, and which at least 20 minutes that may affect the help and some kind of benefit for the reversal of fatty liver.
That sounds good. And what role does lifestyle modification play in preventing fatty liver disease in individuals who are at risk?
Yeah, this is what I said. The most important thing is medicine is not important. People think that I went to the doctor, I got a medicine. There is no medicine for fatty liver. I'm telling you here once again, 100 times I'm telling you, exercise and diet is only the medicine. Without exercise and medicine, exercise and diet, there is no fatty liver reversal. There is no liver cirrhosis reversal. First place, a person get overweight, the first person have a fatty liver, they have to come up, meet a dietitian, nutritionist, a trainer, not the doctor. Not the medical doctor cannot help you. You have to go into a lifestyle modification. Doctor cannot make you any medication. But you have any question, I'll tell you, you have a most important thing is you can have some supplementation. There are supplementation which is a doctor like me, I studied nutrition, my dietitians can prescribe you as silamarin. Silamarin is very important. It's like a plant, and artichoke and beetroot and all this kind of plants has a high ability actually to reverse the fatty liver, and this also can help you to lose weight.
Yeah. So Dr. Jaison, today is the global. Dr. Jaison, what is the importance of this live?
So once again, we said it's a global fatty liver day. Many people are ignorant actually when they do a basic test. An example, doctors, like today I had an event. This is what I wanted to tell you. Actually, I was with a client like exactly half an hour before, and one of my senior doctor, actually I have Ayurveda doctor, physio doctor, I have a GP, I have an orthopedic surgeon. 100 times I'm telling you, exercise and diet is only the medicine. Without exercise and medicine, exercise and diet, there is no fatty liver reversal. There is no liver cirrhosis reversal. First place, a person get overweight, the first person have a fatty liver, they have to come up, the meet a dietitian, nutritionist, a trainer, not the doctor. Not the medical doctor cannot help you. You have to go into a lifestyle modification. Doctor cannot make you any medication. But you have any question, I'll tell you, you have a most important thing is you can have some supplementation. There are supplementation which is a doctor like me, I studied nutrition, my dietitians can prescribe you as silamarin. Silamarin is very important. It's like a plant, an artichoke and beetroot and all this kind of plants has a high ability actually to reverse the fatty liver, and this also can help you to lose weight.
Yeah, so Dr. Jaison, today is the Global Fatty Liver Day. What is your message to the audience?
Okay, thank you very much. So once again, this interaction with Mr. Joy was very simple. This is not a completion because I am actually going to do a 100-day program for a gut and the correlation between the gut and the fatty liver. So I will be coming up with the next week onwards. There will be a daily videos of fatty liver, how important is fatty liver, and people with the fatty liver suffering with the fatty liver, how they can reverse fatty liver, how if somebody with the PCOD, they have actually a fatty liver. When women get a hormonal issue, that's the first place they get a fatty liver. And always the doctors are treated with the, if someone with a PCOD, they give them some contraceptives or birth control pills or which is contraceptives and maybe a diabetic medicine, and most of the time they don't go to the root causes, and actually this lady will be already have, the women will be already having a, the girl will be already having a fatty liver. If they're treated with the fatty liver, if they change the lifestyle with the fatty liver, they have a better or higher success rate for weight loss and to reverse their PCOD, reverse the sugar condition, because PCOD is actually diabetic, so you have to be careful. So my conclusion here is very important. People with extra belly fat, they have to be very careful. Today is a Global Fatty Liver Day. If you have an extra belly fat, 5 kg, 10 kg, you don't have to be obese. Because if you don't have even obese, because some people get fat internally. I eat everything, I'm not overweight. That's the person has to be even worried more. You understand why? Genetically, they put all the fat internally, and they have high chance to have a fatty liver, cholesterol, BP, because all the fat is going internally. So don't think that if your height weight equation, you are ideal weight, that's not an equation for the health. You must go and check it out. That's my personal message. And very important thing is, everyone out there, around 85% of the population, they saying more than grade 1 fatty liver they have. So very important, if you are thinking that you have a fatty liver, go and check, do a fibro scan, or at least start doing the lifestyle modification and do some action. And the lifestyle and exercise is very important, and do the needful, otherwise it's not going to help you. So please, my request today, lose weight, get fit, move your bum, exercise, lifestyle change, modification, then you can lose weight and get fit.
Thank you very much, Dr. Jaison, for the all information.
Thank you very much.
Really
And I'll be coming up with more with a Body Perfect Doctor Show.